Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. Before starting this series, have you read the Intervention Testing, Piloting, and Staging brief and completed the first section of the workbook? If not, we recommend you take some time to complete these steps and then return here to where you left off. Before we begin, we'd like you to take a few minutes to consider your own experience with testing, piloting, and staging interventions. Have you ever needed to know if something would work the way you intended? How did you figure out if it would? Can you think of a time when you tested something out on a smaller scale to make sure it worked the way you needed it to on a large scale? How did you know whether or not it worked? How did you know which adjustments to make before going bigger? Use your intervention testing, piloting, and staging workbook to write down your answers to these questions. Remember, you can pause this video at any time to record your thoughts and refer to them as you complete all 11 videos in the series. Before digging in, let's check in on a few key milestones teams should have in place before they begin looking at testing, piloting, and staging. They should ensure that the team is formed with diverse expertise and representation to guide the change and implementation process. This includes ensuring you have the necessary expertise or support, such as staff or partners, to do complete testing and connect it to a broader monitoring and evaluation plan for the intervention. And that the team has a clearly identified problem and an analysis of the root cause or causes of the problem, a theory of change that reflects a clear pathway from the problem to a desired long-term outcome, and have identified, adapted, or designed an appropriate intervention that is well-defined, a good fit, and feasible within the agency's system, readiness assessment findings that include the areas of strength and capacity needs for the selected intervention or interventions, and an implementation plan that incorporates plans to build needed capacities for implementation is in place. Taking the time to ensure that these key milestones are in place before moving into testing, piloting, and staging an intervention will increase the likelihood of successful implementation of the intervention. Let's take a quick moment to review the two types of testing included in the brief. Usability testing is a process that helps teams quickly try out critical intervention elements, assess their functionality, and then refine or clarify as needed. Pilot testing or piloting is a trial run of the implementation of a whole intervention or significant parts of it on a small scale, for example, in a single county or an agency division. The term usability testing comes from business practices of testing new technology with potential users. Similarly, implementation teams can test interventions, implementation processes, or tools with small groups of individuals who deliver services or those who receive them. For example, testing assessment processes or data collection forms with caseworkers or contracted service providers, as well as foster parents or youth in care. Usability testing is often a quick cycle of plan, do, study, act. Planning what processes or tools to test, testing them with the relevant groups, monitoring the results through feedback, and then making adjustments as needed. Teams may even choose to have some processes or tools go through more than one round of usability testing, with the revised versions to ensure that they meet the needs of the users in the context that they will be used and the way they are intended to be used. Usability testing can be done before a pilot test or a launch of the intervention, or during the implementation. It is a valuable way to analyze and improve pieces of the intervention, and doing usability testing regularly sets a strong foundation for continuous quality improvement efforts. Usability testing will be explained more thoroughly in Modules 2 and 3 of this series. While similar concepts, usability testing and pilot testing differ in focus and scope. Let's review these differences briefly. Usability testing is usually quick, targeted, and focused on a more specific aspect of an intervention or implementation process, such as a tool or a procedure. It answers the questions: does the process or tool work? Does it make sense to staff and/or participants? Is it being used as anticipated? Pilot testing, on the other hand, is more comprehensive and may take longer to complete. It is essentially the implementation of the entire intervention, or at least a major component of it, under carefully selected conditions like a specific geographic area or a specific target population. Pilot testing answers the questions of whether or not the implementation of the intervention is successful, what effect the implementation may have had on the selected short-term outcomes, and also what conditions or supports might be needed to have effective implementation or replicate it on a larger scale. After teams conduct usability and/or pilot testing, they will begin implementing the intervention in one of several ways based on their time frame and the scope of the intervention. When teams scale up an intervention, they increase the number of sites, locations, or units implementing the intervention in a deliberate and sustainable way. It could look like replication of a program in a new area or with a new population, the adaptation of a program for a new context, the expansion of a program to a larger number of sites, or expanding the capacity of existing implementation sites to serve a larger number of people. This method supports effective change efforts by increasing the size of the intervention in manageable pieces. Staging interventions refers to strategically rolling out the intervention, for example, either by a geographic area, such as regions, counties, or cluster, or rolling out different components over time. For example, rolling out family group meetings and then changes to permanency reviews. Staging gives teams an opportunity to purposefully allocate resources, gradually adjust, and then learn during the process. Sometimes teams choose to do a statewide launch rather than scale up or stage incrementally. Often when they are under tightly mandated timeframes, or when the intervention is smaller or of limited scope. Teams need to consider several contextual factors when making this decision, such as the complexity of the intervention, whether it is a new, untested intervention or a well-known program. What are the risks and benefits to each approach? And what are some things that the jurisdiction can do to lessen the risk if a statewide launch is necessary? Implementation science models pose that the ideal scenario for implementing an intervention or new practice is to move from the adaptation or design process into usability testing, and then pilot testing, and then staging or scaling up. In reality, this isn't always feasible, and where teams choose to begin testing and scaling up may depend on a number of factors, including the purpose of the intervention, the existing evidence base for the intervention, and any mandates or timeframes that may require moving more quickly to a large-scale launch. If an intervention is newly designed or does not already have a strong evidence base, then usability testing is the logical starting place. If an intervention is well supported but adapted for a different population or context, then usability testing or pilot testing is highly recommended. If an intervention is well supported by research evidence and is being replicated with a similar population in a similar environment, then the agency may consider pilot testing and then staging or scaling up or moving directly into staging the intervention. Some circumstances, for example, federal, state, or legislative mandates, perceptions of low risk, or tight timeframes, may prompt the team to decide to move more quickly from identification of an intervention to launching on a large scale. Usability testing, pilot testing, and evaluation are all parts of important data-driven feedback loops. Testing helps agencies make needed improvements, prepare for staging the intervention on a larger scale, and conduct evaluations of the intervention and the implementation process. Summative evaluation uses data gathered during testing to guide improvements about both the intervention and the implementation process. Formative evaluation explores whether implementation is happening as it is intended to and identify if the outputs or short-term outcomes are on track. Usability and pilot testing can support formative evaluation by informing data collection protocols and identifying barriers that may need to be addressed before staging the intervention on a larger scale. Summative evaluation assesses the effectiveness of the intervention. Does it achieve the desired outcomes? Usability testing and pilot testing can help to improve the intervention's likelihood of success by giving the team an opportunity to adjust and refine the intervention as needed. And these adjustments should be completed and the intervention should be stable before collecting any data related to a summative evaluation, as any additional changes can impact the quality of the data. More information about formative and summative evaluation are in the Change in Implementation and Practice series on monitoring, evaluating, and applying findings. The Intervention Testing, Piloting, and Staging Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention, and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. Intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks. It is important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, in practice, often the steps will overlap, and teams may loop back and forth between the functions as they test, pilot, and stage. Part 1 is usability testing, and includes creating a usability testing plan, and then conducting usability testing, analyzing results, and making adjustments. Part 2 is piloting, and includes determining the approach and developing a plan, identifying and recruiting sites, conducting the pilot, and assessing results, reviewing progress, and then making adjustments. And Part 3 is staging and scaling up, including developing, refining plans for the staging the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, and then reviewing progress and benchmarks. In this module, we will kick off our conversation about intervention testing, piloting, and staging by looking at each part in a little more detail and considering how they work together to support implementation of new programs and interventions. Part 1 of the Intervention Testing, Piloting, and Staging brief is focused on usability testing. It includes 2 essential functions that help agencies determine what, if any, pieces of the program or intervention might benefit from usability testing, and what benefit it might offer the team. Create usability testing plan, and then conduct usability testing, analyze results, and make adjustments. Usability testing allows teams to try out critical intervention components and implementation procedures and see how they work. It may be particularly helpful to test tools, forms, and processes that are being used or adapted for the first time so that they can be refined and finalized as needed. As an initial test, usability testing provides insights into user experiences with the process or tool and whether modifications are needed. This early testing can pave the way for implementation and later evaluation. Part 2 of the brief is pilot testing. Piloting helps agencies try out a program or practice with a small subgroup of workers and families to inform decisions about expanding, adjusting, or discontinuing its implementation. The 4 essential functions or steps in the brief include determining the pilot approach and developing a plan, identifying and recruiting sites, conducting the pilot, and then assessing results, reviewing progress, and making adjustments. Teams can use lessons learned from the trial run to make improvements to the intervention or the implementation approach and improve their chances for sustainable success. In Part 3 of the Intervention Testing, Piloting, and Staging Brief, teams will develop plans for staging an intervention and scaling up. As noted earlier, teams may take different paths for rolling out and scaling up an intervention. When making this decision, they should consider the intervention's scope and complexity, related mandates and timeframes, the intervention's implementation history and evidence base, and available capacity, including the workforce's ability to take on new practices. This part of the brief offers 4 essential functions or steps that can support jurisdictions who are prepared to launch, stage, or scale up an intervention, including developing or refining plans for staging the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, and then reviewing progress and benchmarks. Let's take a moment to recap what you've learned about the key phases and essential functions in the intervention testing, piloting, and staging brief. Why should teams consider usability testing? Because it allows teams to try out critical processes or tools to see how they work. Why should teams consider pilot testing? Because it allows teams to try out a complete intervention or core components with a small subgroup of workers and families to inform decisions about expanding, adjusting, or discontinuing its implementation. What should teams consider when deciding to stage an intervention or launch statewide? Teams should consider the intervention's scope and complexity, related mandates and timeframes, the intervention's history and evidence base, and available capacity, including workforce ability. Up next is a more in-depth look at Create Usability Testing Plan, the first function in Part 1 of the Intervention Testing, Piloting, and Staging Brief.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.